All right. Okay, we're going to begin our press briefing for today. This is a joint City of Corpus Christi, Nueces County press briefing. And today we're featuring the work of Dr. Bird and his team, and that'll be the primary focus. It's just going to be myself and Annette, and then we're going to turn the attention over to Dr. Bird, who will be here remotely today. He won't be in person, but he'll be WebExing in from a remote location. And so we want to thank those of you who are watching. I'm going to provide you the statistics on the number of new cases for today, talk to you about hospitalizations and number of deaths as well. Annette will give us some updates on the health of the health district situation, testing, and that type of thing. And then Dr. Bird will do his updated graphs and projecting, among other things. Okay, so let's get right to the statistics for today. So today we have 85 new COVID-19 cases for Nueces County. And you can see that on the graph here. At 98 yesterday, 97 on, what was that, Tuesday, 81 for Monday. So that number's not bad. This next chart shows us today's 85, and it shows us a little bit more of the back weeks. So this is a 2-week perspective. If we go to the next chart, and so 2-week perspective, the blue purplish bars are the ones identified for the day by primarily our health district and other local testing entities. And then the yellow is the state database or data drops or data dumps put into the right days. And so this shows you a 2-week perspective of the state's cases that they've given us. And those numbers are in red, and the number of cases are in the yellow bars. This next chart gives us a little bit more perspective. It gives us all the way back to June 1. And it also shows in the upper left-hand corner the total of 11 data drops that we have received. That's the totality of them. So we've received 11 data drops with 2,814 cases. The first data drop was July 1. There were several, August 9, 10, 12, 13, 14, 15, 16, 18, 19. And then today, which is the 20th, we only received 21 today. And so you can see those. And then the placement of them are primarily shown here in that June 1 timeframe through August 17. However, they do go back as early as April 2nd. So what's not shown on this graph are numbers from April and May and June, or April and May. But those numbers are not too large. You can see the bigger ones were kind of in this middle of July timeframe. And then in recent times, they're coming down, and the date range is more closer to today's date than in the past. Okay, so that helps understand the state data drops that we get. Now, this chart shows us our position in terms of recoveries and then active cases, and we do want that orange slice to take more up of the circle. And so today we have about 9,356 recovered people, and then just under 8,000 persons that are active still in Nueces County in terms of the virus still being active. 303 deaths are shown on the chart, and I'll talk about deaths in a little bit more in the presentation. And so 54% is the recovered rate, and then 46% of the cases are still active. And then let's look at hospitalizations. We're seeing a very slow descend in the number of persons hospitalized with COVID-19. Today is a good example of that. So there's 4 fewer persons in the hospital today than yesterday. So yesterday there was 224. Today, there's 220 in the hospital. That's a decrease of 4. And then of those 220, 78 are needing more care than not. They're in intensive care. And that, though, also is a decrease of 2 from yesterday when we had 80 people in ICU yesterday. Today, it's 78, a decrease of 2. And then on the number of deaths in Nueces County, we're up to 303 deaths, and that's 3 more than yesterday. So yesterday we had 300 deaths as of that point in time, but today we're at 303, so a gain of just 3, which is good. In weeks past it had been, the average is probably 10, 15. So 3 is a good number. It's still a bad statistic, but it's coming down also in terms of numbers per day. And then this final graph just shows you our curve, and the blue bars show the number of cases per day. You can see we reached kind of a peak in the mid-July timeframe, and you can see that by the blue bars, but if you follow the red line, you can see that as well. There was an ascending of the peak and then reaching of the peak, and now we're slowly descending. And you can see down here, it's kind of flattening out a little bit, but the goal is we wanted to get all the way down to that 0 again, and have very few cases per week or per day. So the 7-day average based, or the daily average based in the last 7 days now is 93 new cases a day. Just a little over a week ago, it was in the 200s per day, the average number of positives per day. So today's number, let me just get back to that real quick. Today's number of 85 is below the 7-day average of 93, which is a good stat as well. Okay, so that concludes my part of the presentation. We're going to have Gabby translate this into Spanish, and then Annette Rodriguez, our Public Health Director, will speak for a moment or two, and then we're going to have Dr. Bird live from a WebEx location.
85 casos confirmados por el coronavirus, haciendo un total de 17,579 casos. 9,356 pacientes se han recuperado por completo, 220 personas continúan en el hospital, 78 están en la unidad de cuidados intensivos, 7,941 personas continúan con casos activos. El día de hoy se reportan 3 fallecimientos. A la fecha, los fallecimientos totalizan 303 personas. El porcentaje de personas positivas al virus también ha disminuido y se cuenta con un promedio diario de 93 personas. Ahora la directora del Distrito de Salud Pública, Annette Rodríguez, va a dar su reporte.
Good afternoon, Annette Rodriguez, Public Health Director. Our condolences to the family and friends of the 3 individuals that lost their lives to COVID-19 today. The Health District held a drive-through yesterday, and 17 individuals were tested. Of those 17, 3 tested positive. If you are having COVID-19 symptoms, please call our hotline at 826-7200 to be screened. Our phone bank volume is currently very low. We've actually had 3 days where we have not had anyone sign up to go through the drive-through. The Health District recently concluded a series of drive-through immunization clinics for students who needed to get vaccinated for back-to-school purposes. We gave out a total of 542 vaccines. If you still need to get your student vaccinated, please call our immunization hotline at 361-826-7238, and they will help you to get your student vaccinated. Our health department is currently calling our positive COVID-19s to see if they have completely recovered. We realize that we probably have many more people that have recovered than we have accounted for at this time. So now that the volume is a little slower at this time, we are calling to check on them. While calling our positive cases, our staff spoke with one individual who said yes, she was completely recovered. But you could hear the distress and the quiver in her voice as she responded to our questions. This was a young lady in her 30s, so staff felt like there was no reason for her to be upset with the health department for checking on her. When asked if she was okay, she said no. Her husband, also in his mid-30s, had just died in their home a few weeks earlier from COVID-19, and her children were having a really difficult time. These are real situations that are occurring here in Nueces County. So while our numbers are decreasing, we have to understand that we still must be extremely mindful of where we have been and what may still lie ahead. We have no COVID-19 vaccine, and we still don't have any specific treatments to fight this disease. We should continue to be diligent in our practices. We must believe that there will be an end to this one day. It sounds like an eternity, maybe 4 or 5 more months, but those of us older and wiser know that 4 or 5 months is not an eternity. Time is precious, and time passes very quickly if you aren't using it wisely. Cherish the time you have right now with your family. 6 months of COVID-19 have already passed. We can endure a few more months knowing that we can come out safe on the other side by practicing simple strategies. Wear your mask when out in public. Social distance as far away from strangers and the elderly to protect them as possible, and wash your hands as often as possible. These simplistic but effective measures can help us decrease the number of people dying from the virus. The lower our numbers, the lower the probability of getting the virus. The lower the probability the lower the number of hospitalized patients, and also the lower the number of deaths. The whole community needs to do their part. CDC recommends that everyone 6 months of age and older get a flu vaccine. Try to get it a few weeks before flu season starts so you can build up some immunity. Flu season starts October 1st. There may not be a vaccine for COVID-19, but we do have a vaccine for seasonal flu. If you are allergic to eggs, there are vaccines that are made that do not have egg products in them. So no excuses. Let's all get vaccinated. Stay healthy, stay focused, and stay informed. Thank you.
Queremos ofrecer nuestro más sentido pésame a los familiares y amigos de las 3 personas reportadas fallecidas el día de hoy. Ayer se llevó a cabo la toma de 17 muestras, de las cuales 3 personas resultaron positivas. Si usted cuenta con síntomas del COVID-19, llame a nuestra línea directa al 361-826-7200 para que le hagan una prueba. Nuestro volumen de llamadas ha disminuido considerablemente. En los últimos 3 días no hemos contado con ninguna persona registrada. Recientemente concluimos con una serie de clínicas de vacunación para estudiantes. 524 vacunas fueron distribuidas. Si aún necesita vacunar a su estudiante, por favor llame a nuestra clínica de inmunización al 361-826-7238 para hacer una cita. El personal de nuestro Departamento de Salud también se ha estado comunicando con las personas que dieron resultados positivos para determinar si ya se han recuperado y así actualizar nuestra información. Desafortunadamente, una de esas llamadas fue a una mujer quien indicó que ella ya se había recuperado, pero su esposo, quien se encontraba en sus años 30, perdió la vida por complicaciones del virus. Esas son las situaciones como las que están pasando en nuestro condado algunas personas. A pesar de que las cifras van en descenso, aún no debemos bajar la guardia. No se cuenta con vacuna contra el virus ni tratamiento para atender a las personas que lo portan. Ya son 6 meses desde que el virus fue reportado en nuestro condado. Esperemos que su salida sea pronto. Y eso puede ocurrir al seguir con unas simples medidas sanitarias. Use su cubrebocas cuando esté en público, continúe practicando el distanciamiento social, lave sus manos frecuentemente y desinfecte las superficies tocadas más comúnmente. Asimismo, los Centros de Control de Enfermedades recomiendan a la población vacunarse contra la influenza. Esta es recomendada para personas mayores a los 6 meses de edad. Y si usted es alérgico al huevo, el cual se encuentra en esa vacuna, existen vacunas especiales para aquellas personas con alergias. A continuación, la presentación de Dr. Bird de la Universidad Texas A&M.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to talk to you on behalf of the COVID-19 Task Force for the Coastal Bend area. The reason why I'm not there in person today is that this afternoon I developed a mild fever and a scratchy throat. And we think it's because I got a flu shot yesterday, but out of an abundance of caution, we decided it was the best way forward was to deliver the presentation remotely today. So let's see if we can make this happen. There we go. Just to remind you, the objectives of the task force are to address your concerns and questions about COVID-19 and the interventions that are taking place to control the spread of COVID-19 in the Coastal Bend area in Texas. And our other goal is to enable evidence-based decision-making so that our leaders can make informed decisions for us. Each week we talk about what an outbreak is. Once again, it's a rapid rise in the occurrence of disease. Right here in the Coastal Bend area, we're in the middle of an outbreak that started right around Memorial Day at the beginning of the summer. An outbreak can be localized or widespread. We're also in the middle of an outbreak in the whole world, the COVID-19 pandemic. The graphic that you're seeing shows how the virus COVID-19 can spread. This is a transmission rate of 2, where one person infects 2 additional people, and you can see very quickly after a few generations of passing on the virus time after time that you end up with a lot of people being infected, and that's why COVID-19 is so hard to deal with. Not only that, it's transmitted through the air, through surfaces, and through direct contact. And I'll reiterate that last week there was a new peer-reviewed published study that indicated that indeed COVID-19 is airborne. In the weeks before that, there was a debate on how small the particles were that COVID-19 could be transmitted in, and now they can be even transmitted in microscopic particles through the air. So you want to wear your masks when you're inside especially, but even when you're outside, it's starting to be recommended that you wear masks and do your best to social distance and keep proper hygiene to prevent the spread. There are a few interventions that are in place. One, you're still encouraged to stay at home if you can. 2, social distancing, face coverings, and the number of people in a gathering are being limited right now. Face coverings are mandatory in most places. Self-isolate when you're symptomatic, kind of like what I'm doing now. Even though I think have some symptoms of a flu or a cold because I just got a flu shot, I don't know to a certainty that that's the case. So I'm self-isolating until we can figure that out. There were school closures, but schools are slowly getting back in session with a lot of remote learning occurring. But there's also some face-to-face learning that's occurring, at least at TAMU CC right now. And then we've gone through a number of stages of reopening Texas after the initial shutting down. And so that was Open Texas Phase 1, Open Texas Phase 2, and then Open Texas Phase 3. And after 3 or 4 weeks of Open Texas Phase 3, we realized that maybe that wasn't such a good idea. Phase 3 was repealed effectively. And then a week later, Phase 2 was partially rolled back also by the governor of the state of Texas. And that's where we stand now. For the past 6+ weeks, we've been trying to get control of this outbreak that's occurred locally and in the state of Texas. Just as last week, we estimate that the transmission rate in the Coastal Bend area is somewhere between 0.9 and 1.1. These are 2 estimates, the best estimate we can get from 2 different models. One says 0.9, one says 1.1. We can go by the cases and say that at least 2 weeks ago, it looks like the transmission rate was below 1. But the fact that one of the models is saying that the transmission rate is above 1 gives us a little bit of concern for the coming weeks. Now, a transmission rate of 1.1 isn't that high. And to give you an idea of what this relates to, if one person has COVID-19, they're likely after 1 week to pass it on to 1 additional person. That person passes it on to 1 additional person after week 2, and then another person gets infected after week 3, and another person after week 4, for 5 people infected in 1 month. Now that's not a lot of people, and all those grayed out people in the background is a transmission rate of 3, which is where we estimate we were at when Open Texas Phase 3 was repealed on June 26th. Now, that being said, if we start with more than 1 person being infected, say, with thousands of people being infected, where right now there's thousands of active cases, then even a transmission rate around 1 can result in a lot more people getting infected. And so we're not out of the woods here by any means. And the fact that there are such a large number of infections right now means that we want to continue to be vigilant. We're going to give a little better look at how the transmission rate has changed over the course of the pandemic. So this graph in the line and the gray ribbon shows you the estimated transmission rate in black, and then our confidence levels in the grays. The reason why you see it jumping up and down is that this model is parameterized by both fatality data, which doesn't change that severely that often, and cell phone data, which does change that severely that often. So these jumps up and down are being driven by cell phone data. And this is for Public Health Region 11, which is all of South Texas. You can see that here in the Public Health Region 11, it got up to around 2, possibly even higher than that with the confidence intervals, before dropping back down after rolling back open Texas Phase 3. And then in the last week or two, it's been showing a slow increase in its estimated transmission rate. So this is a view of the model that's estimating that the present transmission rate in the coastal bend is 1.1, but you can see how that's changed through time. We can make another graphic from this for the whole state that I'm showing here that's color-coded. And the white means there's essentially somewhere between a 40 and 60% chance that the transmission rate is less than 1. And what that equates to is it's a coin flip right now. It's a 50% chance that it's lower than 1. It's a 50% chance that it's higher than 1. Kind of right in line with our estimates of the transmission rate. So we're in Public Health Region 11 here. You can see in the Public Health Region above us, which includes Victoria and San Antonio, there's a little bit higher probability that the transmission rate is below 1. And then up here in the northeast corner of Texas, with Longview and some other places, there's a much lower probability that the transmission rate is below 1. So red is bad on this graph, blue is good, white is in the middle. This report is mainly for the 12-county coastal bend area, and we provide context for comparisons amongst locations in other parts of Texas and sometimes other parts of the country. These figures are heat maps that show you the darker the color of red, the more total cases there have been in that area. So you can look at the state of Texas and you can kind of see where you have Houston, Dallas, Fort Worth, San Antonio, and Austin here. And here we are in the coastal bend and Nueces County here, and then down in McAllen and the Brownsville area and Laredo. So the most populous areas are really the places with the most cases. And the same thing is happening in the coastal bend area, with the exception that B County has a few more cases, 300 more cases approximately than San Patricio County, which is right here. But both of them and the rest of the coastal bend have many fewer total cases than Nueces County. If we're to look at this in another way, in the whole coastal bend right now, we estimate there's been 19,021 cases. Now, I want to emphasize that these are confirmed cases of COVID-19, and the definition of confirmed is that the person who is sick tested positive with what I call a PCR test. It's the kind of gold standard test. And if a doctor diagnoses you with COVID-19 and you test positive with an antibody test or an antigen test, you get classified as a probable. And so those probables and confirms are being reported locally because the probables are probably COVID-19. But for us on the task force, because at the state level, the data is only confirmed cases, we remove the probables so that we can see just the confirmed for comparison. So that's why the numbers are a little bit different, as well as because these numbers come from the state, they're a couple days behind what's reported here by City Manager Zanoni. So we're at almost 13,000 recoveries in the coastal bend from confirmed cases, and around 5,700 active confirmed cases in the coastal bend area right now. just for some context, we did have a first wave back in March and April, and you can't even see it on this plot anymore because the number of cases has increased or has accumulated so much. These are the total cases. So this dark blue line, it's never going to go down. It will only level off if we stop getting new cases or go higher if we get new cases. So you can barely even tell that there was any wave that occurred here. And then we had our localized outbreaks, and you can still kind of detect that that blue line jumps up a little bit. And that was from the meatpacking plant and the transitional housing facilities, which at the time seemed pretty scary, but now in hindsight, it was nothing compared to what we've gone through in the past month and a half here in the Coastal Bend area with the Texas-wide outbreak. All right, each week we like to give you our best estimate of the percent positive tests that are coming back. These are from the PCR tests, so these are the gold standard tests for COVID-19 that can detect if you're infected. Basically, if they come back positive, you definitely have COVID-19. And we use these two data sources instead of all of the testing that's being done because these are the only two data sources from the Nueces Public Health Department or Corpus Christi Public Health Department and the Texas mobile testing that's occurring where we know the number of negatives also. Now, for all of the testing that's being done, we are getting the number of positives, even if it's later, but we don't necessarily get the number of negative tests that come back. And so you need both the negatives and the positives to get an accurate estimate of the proportion of people that are testing positive. So right now, our best estimate for the data from the Nueces Public Health Department is that 29% of the people getting tested through that method are coming back positive. You have to be symptomatic to qualify to get this testing. And so what this means is that 29% of people that have symptoms of COVID-19 and go and get tested for it are coming back positive from the public health department's testing. Now, for the mobile testing that's occurring, the number's a little bit lower, although since last week, it's gone up. Remember, last week it was about 9.7%, and this week we're at 17% on average. So there's been an increase, at least in these mobile testing stations. Now, I don't know everything that happens with this data, and I think it's important to remember that each one of these circles represents people. It's not just a circle on a graph. It's not just a number. There's people behind it, and it depends on who the people were and why they were getting tested. That's going to affect what the percent positives were. We know back here, anybody was qualified to get a test, whether you were symptomatic or not. And we suspect that that played a role in the sort of dramatic decrease in the number of percent positives that we saw. I don't know if that has changed this week, but you might hypothesize that it has changed given this jump up, or at the very least, fewer people that were asymptomatic were getting tested. So those are our best estimates. Just as a reminder, looking back at Memorial Day, we were at 1% in both of these metrics. So if you're wondering, is it 17% or is it 29% or is it 9% like it was last week? Any way you slice it, it's way higher than it was before this present outbreak that we're in right now. And it's unacceptably high. And it's one of the reasons why I'm saying we're not out of the woods yet. We need to continue our efforts to control the spread of COVID. We look at the number of tests being done. Over the past week, there's been approximately 182 tests done per day on average when the tests are getting done by the mobile testing stations and by the public health district, on average about 21 people tested per day. And you can see that it's leveled off if you look at the data points themselves. And we believe that, for lack of a better reason, the reason why there's less people getting tested is that there's less people that feel like they're becoming symptomatic with indicators that they might be infected with COVID-19. We don't know of any shortages in the number of tests available, and there are no efforts to discourage people from getting tested. And so the only real logical explanation for the decrease in tests is fewer people are trying to get tested. Okay, we're gonna show the rankings of the number of cases per day. So these are the different trauma service areas across Texas. And what we did was we put in the name of a popular city that falls within those trauma service areas, but the whole state of Texas is encompassed within this figure. And we can see that right now in the coastal bend, we're trending down towards the middle of the pack. We're still kind of in this mid-tier, lower than Laredo, Dallas, Fort Worth, lower Rio Grande Valley, and El Paso, but higher than several other places like Galveston, Victoria, and you can go on down the list. One thing that I'll note here is that we're able to deal with the data dumps, and that's my name for it when I'm presenting, because they're pretty frustrating. They might frustrate some of you as much as it frustrates us, but then we have to go back and deal with these. And what we do is we assign, by we, I don't mean me, there's dedicated people at the city that are going back and figuring out the dates that these tests occurred, making sure that we're only recording one test per person. And in doing that, our data here in the coastal bend is a little bit different than all the other data. So if other trauma service areas are getting data dumps, we don't know how to redistribute that data, and the state is not redistributing that data to the correct date. The data dumps are getting reported on the day that the trauma service area finds out about them, even though they could go back all the way to April, as you heard City Manager Zanoni talk about earlier. For us, we redistribute them, and that could decrease our ranking slightly against the other locations, because at the very least, I know that it's been in the news that Dallas got a pretty big data dump, and that may be why this number is so high for them and the ranking is so high. Anyway, through time, hopefully this will pass and we'll get a more accurate ranking across the whole state. But this is the best that we can do right now. In terms of the number of new cases, that same scenario applies. We have dealt with the data dumps only in Nueces, and so part of the South Texas data here, when we're looking at the whole state and the number of new cases per day per 100,000 people, some of the South Texas data is data that we've figured out which date those data dumps apply to. Regardless, there's a decline, which is what we like to see. But for Dallas, we're not able to do that, and that may be one factor that's causing this increase in the number of new cases per day that we're getting from the state's database. For all the other areas in Texas, we're seeing a decline in the number of new cases per day, and that's a good sign. For the South Texas area and maybe some of the more populous counties, especially with a focus on the coastal bend area, what we see across the board are mainly declines in new cases per day. This is a good time to talk about the vertical lines. They're representing when different interventions started and stopped. So, we have the stay-at-home order, then Open Texas Phase 1, 2, 3, rolling back to 2, and then 1.5. And what you'll notice is that the longest period of time of all the intervention regimes that we've been in is this 1.5 that we're in now. And that's kind of the cost for having gone through the Open Texas Phase 3. We had about 1 month of Open Texas Phase 3, and now for a month and a half, maybe almost 2 months now, we've been trying to get the outbreak under control. And we are having success. The number of cases per day is declining. And Nueces, just to draw your attention to it, it's this turquoise line here. Again, data dumps have been redistributed, and there's a nice level of decline there. In terms of the rest of the coastal bend, B County is declining. We think that this peak was due to cases at the correctional facility. San Patricio declining much less rapidly than B. Jim Wells staying approximately level. Clayburgh maybe going up a little bit, but that could be data dumps. We're not 100% sure. And then all the other counties either staying level, like Brooks and Duval, or going down, like Refugio. Okay, moving forward to hospitalizations. We're currently ranked 4th in the number of hospitalizations in the coastal, I'm sorry, not in the coastal bend, but in all of Texas per capita, the coastal bend is ranked 4th. Now, this isn't 4th best, it's 4th worst. We want to be way down here with the fewest number of people in the hospital per day. But unfortunately, right now, we're up here with about 50 people, maybe slightly under 50 people per 100,000 in the population in the hospital. We look at these numbers a little bit more finely, looking at general patients. So we call these med-surg patients because they're in medical or surgical beds. And you can see here the number of patients in the hospital, and the general admission category for COVID-19 is here in red, and we've seen a nice steady decline. This vertical bar here marks the transition from one reporting method to another. And for you guys at home right now, it's not a big deal. It's mainly for us because some of the metrics we look at are affected by this, but here you can see that there's no real effect of that. And the blue represents the non-COVID patients. So the ICU is the one that we're a little bit more concerned about, because you can see over here in May and June, you can see the average number of people that were in the ICU on any one day in the Coastal Bend area. You can see there are very few patients that were COVID positive. So what you're looking at here is the average number of people that are in the ICU on any one day in the Coastal Bend. And now you can track that over here and look and say, wow, look at how many more people are in the ICU even today than would normally be in the ICU before we had this massive outbreak. And a very large number of the people in the ICU, almost 50%, are COVID patients, and the rest are non-COVID patients. So as long as we're well above this 150 line, it means that we're stretching the capacity of the hospitals, and they're operating at a level that they're not used to. It means that our first line workers like nurses and doctors are getting tired because they're having to work a lot to try to keep all these patients taken care of. It's more patients than we're used to having to deal with. And we've had nurses bust in from out of state to help with this, with the stretching of the hospital capacity. So hopefully we can continue this fairly steep decline in the number of people in the ICU in the Coastal Bend area, and keep that going in the right direction, which is down, and maybe we'll get back to these pre-outbreak levels where it's just a few people. Our projected trajectory for how fast that's going to happen is shown here. The dark red line is a model that's, and it's an epidemiological model that's predicting how many patients will be in the hospital in the Coastal Bend area. And the red data points are how many people are actually reported to be in the hospital in the Coastal Bend area. You'll see there's a fairly good fit between the model and the data. The red is representing some uncertainty in the epidemiological model, uncertainty in things like the transmission rate and the effectiveness of the interventions that are taking place. But barring any unforeseen changes, if the transmission rate stays the way that it has been, we expect that the number of hospitalizations will continue to decline along this progression. And this goes out to about 2 weeks in the future from today. The date's not showing up there right now, but this is a 2-week time period into the future. So that's a good sign that we're continuing to project decline. Now moving on to fatalities. Now in terms of fatalities, we're number 3 in the state right now per capita in the Coastal Bend area, behind only Victoria and the lower Rio Grande Valley. And there's a fairly big jump between us and then us top 3 and then the rest of the state. And again, you don't want to be in the top 3 for this. You want to be in last place, like Amarillo down here. On average, there's about 1 person per 100,000 is what it should say right here. One person per day per 100,000 that is dying. Now, the one thing that's really important here is that because the way the data is reported by the state, this is from a few weeks ago, not from today. And the reason why that is because fatalities are being counted as they're being counted from death certificates. That's the data that's getting output by the state, and the only way that we can compare between different regions in the state is to use this data from the death certificates. That takes a little while to report. This graph here shows you explicitly how there's a difference between the data that's getting the new data format that's getting reported by the state in the bright red and the old reporting format in the darker red or brown. So with that old reporting methodology, we're at 303 cases in Nueces presently, and we don't have this style of data for the other counties in the Coastal Bend or the rest of the state because we get this directly from the public health district. This is the original way that the data was reported up until maybe a month ago when we transitioned into this new way of reporting the number of fatalities from death certificates. With that, we're at 359 fatalities in the Coastal Bend area so far. And this leveling off here is not because people aren't dying, it's because the death certificates haven't been counted yet. So it usually takes about 14 days from the date of death to when the death is being recorded by the state. And again, to qualify as one of these fatalities, a person has to have on their death certificate the primary cause of death being from COVID-19, not a secondary cause. So that is probably one of the reasons why the state transitioned to this new methodology, but also the way that the county is reporting the cases now, these also have COVID-19 as the primary reason for death. And again, everybody needs to recognize that it's easy to become desensitized, but this is 359 people so far have died in the Coastal Bend, and we know that it's more that have died already because we just haven't been able to count them yet because there's so many people dying. This is a large amount of fatalities, and in the country, COVID-19 is now the #3 cause of death behind heart disease and cancer. This is the model that projects how many fatalities per day we expect to see. The blue part of the ribbon, or the blue part here, this is the model. The brown points are data points that we think are fairly well filled in, and the death certificates have been counted. The triangular points over here, and this different coloration of the model represents where we stop feeding data into the model from fatalities. And these drop down because not all the death certificates have been counted yet. But this is our projection of where we see these data points moving up to as the death certificates get counted. So this gives you an idea of where we think the number of fatalities per day is presently in the Coastal Bend area, even though they haven't all been counted yet. So it's somewhere around 5. Okay, moving forward to the cell phone data. With the cell phone data, we can look at foot traffic, the proportion of people leaving home, and potential encounters that might happen by cell phones coming near each other. I know that people are concerned about their privacy, and we just want to let you know that when this little window popped up on your phone when you went to use Google Maps or some other app, and it asked you if it could have access to your GPS, and you said yes, then you volunteered to get tracked. And this data is being sold. It's building fortunes for people like Mark Zuckerberg, and it is being used to sell you things. Now, we're not using it to sell you anything. We're using it to try to get a view into the future about what will happen with COVID-19, because as you well know, when you're seeing a new case of COVID-19, that could be coming from an infection that occurred 2 weeks ago, maybe now a week and a half ago. And so if you get infected today, you might not show up as a statistic like the ones that we're showing until a week and a half from now. But the cell phone data can let us know what's happening in a much shorter term and what we might expect to see in the future. So let me show you how. First, we have our first cell phone index here. We're looking at distance traveled and a number of people leaving home. Now we've scaled these all to 100% of normal as defined by the amount of distance traveled on average and the proportion of people leaving home before the COVID-19 outbreak. So when you see points up here around 100, that means 100% of normal. You see them below that, it means that we've been doing something to change our behavior that's decreasing the proportion of people leaving home or the distance traveled. Now, in the past couple weeks, we've seen an increase in the amount of distance traveled by people, but an encouraging continuing decline in the proportion of people leaving home or at least staying level. Excuse me. And now the reason why that's encouraging is because if you're staying home if you can, then it means that you're not contracting COVID-19 and you're not contributing to the spread of COVID-19. If you're traveling, now it doesn't necessarily mean that you're spreading COVID-19, but it means that you're more likely to spread COVID-19 than if you're not traveling. So in that sense, we have a little bit of a conflicting signal. If you remember back to our transmission rate being somewhere between 0.9 and 1.1, with 1 being that tipping point between increasing and decreasing, you'll see that, why we have these that transmission rate and these slightly conflicting signals. So in terms of the number of encounters, on the weekdays, our number of encounters has leveled off after an increase from early July. But on the weekends, it's steadily increasing. Now, this data point is from last Saturday, and this data point is from last Friday. I don't know why the number of encounters declined so much on last Friday, but you can see for the Saturday that it was this continuing trend of increasing numbers of encounters. Now, if we put ourselves inside of a bubble, just because we're near somebody to get counted as an encounter doesn't mean that we're going to spread COVID-19. So if you're wearing your mask, if you're practicing proper hygiene, if you're distancing yourself from other people and maybe avoiding indoor spaces, this doesn't necessarily have to translate into more transmission. And the one way that this doesn't mean more transmission is if you're doing those things, the wearing the mask, social distancing, more than previously. And really, it's not any individual doing it more, there's just more people doing it. That could be an explanation for why this is rising, and yet we don't necessarily see an increase in the number of cases. Masks, hygiene, social distancing, that could account for why this is increasing, but the cases aren't. So keep doing what you're doing, and if you're not wearing a mask, it's really important that you do. This is the same data. It's encounters when two cell phones come near each other, but we've broken it out into the different counties, roughly positioned about how the counties are positioned in space, although not perfectly. And just look at the shape. What you'll see is this general S shape. If you see the S shape, we've been seeing an increase in the amount of encounters. Over here in Aransas, we haven't been seeing an increase in the number of encounters. In Refugio, we haven't. Now, we know across the whole coastal bend that we are seeing an increase, but you can see where in the coastal bend there's increases or not. Like with Brooks, it's been staying about level for the past month and a half, the number of encounters per day. So what we'd like to do is see this level off and not continue to increase, but only time will tell. In terms of essential gatherings in blue, and we labeled home improvement stores and grocery stores as essential versus non-essential gatherings, where we labeled malls, restaurants, bars, and movies and gaming as non-essential. Now, this gaming category is something that we added last week, and for whatever reason, in the last month, it's just really shot up the amount of activity that's occurring in these game rooms around the Coastal Bend area and in Nueces County. But even in malls, restaurants, and bars, we're seeing a slight trend upwards since the end of July. And this is a little bit of cause for concern if we're not social distancing more, wearing masks more than we were before. But if we are, maybe we can do these things safely. If you're outside, if you're getting takeout, it's much more likely that you're not going to transmit or contract COVID-19. And I haven't been to a movie theater. I'm very happy with my TV at home. but it looks like there's been an increase in people attending movies. I know that they opened, and I've read articles this past week about them trying to attract more people there. I myself am going to avoid the movie theater for the foreseeable future. In terms of school foot traffic, we can see at the professional and technical schools, they've had the most activity and have kind of leveled off in the past month. K through 12 is on its way up to the highest level that we've seen since Open Texas Phase 3. Now we know that the schools are essentially closed back then, so this is faculty and staff that are working at the K through 12 schools. And then here, as the school year ramps up, we're going to see an increase in the amount of foot traffic. For universities, it's remained about level after ramping up in midsummer, and junior colleges like Del Mar are on the way up, but still very low compared to normal. Remember, 100 is normal for these categories. And so the amount of activity at these locations of education are very low compared to what we would normally have. Recreational foot traffic, we've had a slight uptick at the beach, perhaps people figuring out ways around the vehicle ban and deciding that they're going to go to the beach even if they have to park and walk. And we know that recently access to the beach by vehicles has been reopened, although that's going to contribute very little to the data point here because it wasn't the entire week at which we looked at for which there was vehicle access. So we expect this will continue to increase through time in the future. And then parks, museums, and other types of recreational foot traffic have remained fairly level and below normal. I think this is a good time to point out that you don't have to stay inside because of the pandemic. If you want to be a good citizen and you're trying to help control the spread of COVID-19, it's okay to be outside. What you want to do is stay away from other people. And if you're outside but staying away from other people, then that's a perfectly healthy activity to engage in. So in summary, we have a Texas-wide outbreak and it's not over, even though we're seeing positive developments in the declines in cases, the declines in hospitalizations, and fatalities. One thing to note is the ICU capacity is still stretched right now above what it would be normally. And so we're still seeing these effects, and basically normally there's 150 people that are in the ICU in the Coastal Bend that are deemed to need to be in the ICU. And now there's less than 150 people that don't have COVID that are getting that level of treatment. So COVID is stopping them from getting that treatment that they normally would. That difference between 150 and the number of people that don't have COVID in the ICU. The transmission rate is around 1, plus or minus 0.1, depending upon the model we look at. The cases indicate that the 0.9 is correct. Some of the cell phone indices point more towards the 1.1, like the number of encounters or the distance traveled, and the sort of non-essential foot traffic to places like restaurants and malls. So that some cell phone data is predicting an increase in the future, although we haven't seen it yet. And this should stress the need to continue our efforts to reduce transmission. This is not the time to relax and take off your mask. If anything, the reason why we're not increasing in number of cases is from people wearing their masks and social distancing and doing all those things that stops the transmission of COVID-19. Everybody has a role to play. If you're a manager or a business owner, you can help to stop the spread of COVID-19 to improve your business. COVID is bad for business. And in the middle of an outbreak, I can't imagine a worse time for business. So to have policies that promote the spread of COVID doesn't make sense for any business. So no shirt, no shoes, no mask, no service. And make sure you close the loopholes in your social distancing policies. At this point, COVID would have found them because it was so widespread in the Coastal Bend area. But with some schools coming online, there may be new loopholes that COVID could exploit. So we want to remain vigilant. And remember, this isn't the first time in history we've been asked to wear masks. 102 years ago, which none of us remembers, there was a global pandemic, and this is the Seattle Police Force practicing social distancing, and they're all wearing masks. If you don't own a business and you're just an average everyday citizen like myself, we can help to stop the spread of COVID-19 also. Wear a mask. It can decrease the transmission rate by up to 50%. If 2 people are wearing masks, that reduces the transmission rate between them, or the probability of transmission, even more. Social distance, 6 feet plus. Self-isolate when sick or exposed. Stay home if you can. Wash your hands, wash your doorknobs, wash the things that need, and sanitize. And when you're washing, soap is better than hand sanitizer. Soap destroys the COVID-19 virus more effectively than hand sanitizer does. So if you have the option, use soap. Avoid social gatherings, use curbside, drive-through, takeout services are going to be safer than dining room services. Support contact tracing and testing. And here's some evidence that wearing a mask works, where somebody wore a mask or didn't wear a mask over these culture media and sneezed, sang, talked, or coughed 2 times. And you can see that bacterial colonies incubated on the Petri dishes that where the person didn't wear a mask, and they didn't grow colonies on the Petri dishes where they did wear a mask. Now, you might say, yeah, but these are bacterial colonies and COVID is a virus, but these bacterial colonies were transmitted in the same droplets that these bacteria could be transmitted in. And remember, there's some evidence out there now that COVID can be transmitted in even smaller droplets than these bacteria were transmitted in. And the long story short, masks work. We'd like to acknowledge all the people that help put this together every week, and remind you all that the task force is not just Texas A&M Corpus Christi, but it also involves the county, the city, the public health district, the Coastal Bend Regional Advisory Council, as well as medical professionals and other citizens that help us with messaging and making sure that the graphs we show are understandable. So thank you to everybody for that. And I think we'll have a translation.
Le queremos recordar que el virus que causa el COVID-19 es volátil y se encuentra en el aire, así como en diversas superficies, por lo que es muy fácil contraerlo y es sumamente contagioso. Le pedimos seguir tomando sus precauciones sanitarias. De acuerdo a las últimas cifras, el radio de transmisión es de 1.1 personas, el cual ha disminuido considerablemente. En el área de la costa, la cual consta con 12 condados, se reportan poco más de 19,000 casos comprobados por el coronavirus y se excluye los casos probables. De acuerdo a los resultados del Distrito de Salud, el 29% de las personas que han tenido la prueba han resultado positivas. En promedio se llevan a cabo 182 tomas de muestras móviles y 21 por parte del Departamento de Salud. No se sabe exactamente cuál es la razón. Posiblemente menos gente cuenta con los síntomas y no cree necesaria tomar la prueba. Las hospitalizaciones y casos positivos en el estado continúan disminuyendo en nuestra área, pero aún seguimos siendo el tercer lugar en el estado debido al número de fatalidades. En comparación a la cifra del condado de Nueces, en el área de la costa esa cifra es de 359. Los fallecimientos se están contando hasta que el certificado de defunción ha sido emitido, el cual puede tardar hasta 14 días después de la muerte de una persona. El número de encuentros entre personas han disminuido, lo que se cree más gente se está quedando en sus hogares, excepto durante los fines de semana, cuando los encuentros han aumentado. Las reuniones de personas que han salido a los centros de recreo también han aumentado considerablemente. En resumen, el brote por el virus aún no ha terminado. Los casos positivos en el área de la costa han disminuido. El radio de transmisión es de 0.9 a 1.1 personas y las hospitalizaciones también han declinado.
See, okay, thank you very much. I think we're going to do the question and answer period now with Dr. Davey Edwards.
Yes, thank you. There wasn't very many questions today, the only one that I have is really a comment about Labor Day as we move into Labor Day coming up, and how that is related to Memorial Day, if at all, any advice, any maybe idea of what may happen if we have another, especially at the level we're at right now.
If the same thing happens on Labor Day as happened on Memorial Day, combined with a sustained feeling that we are out of the woods and people stop wearing masks, then we should expect to see another huge increase in the cases of COVID-19 in the Coastal Bend area. And it potentially could be even worse under that scenario because more people have COVID to start with than did at Memorial Day. Now, that being said, if we continue to be vigilant and we continue to social distance and we don't throw parties and we wear masks, then hopefully we're able to avoid another outbreak. Now, the outbreak that we had wasn't necessarily caused by Memorial Day itself, but Memorial Day is when it started, and the activities that occurred on that weekend, it's not a coincidence that 2 weeks later, remember what we do today usually shows up 2 weeks later, about 2 weeks after Memorial Day, we started watching this rise in cases. And at first we called it Memorial Day bump. And then next week we were wondering if it was something more. And then the week after that, we were convinced it was something more. And then the week after that may have been the week that Texas started to roll back open Texas phase 3. So we want to be vigilant, and Labor Day is not and should not be this year the time to forget about COVID-19, because the virus is not going to forget how to get transmitted from one person to another.
Hey, thank you, Dr. Burden, and I really appreciate you coming out and giving your presentation when you're kind of feeling a little bit under the weather. You're doing good for the task force, and we appreciate that.
All right, thank you.
Okay, do you have any questions from Chris Hicks? Okay, that concludes our press briefing. Now, just on schedule, next week, Tuesday, Dr. Bird's going to be back, and because he's going to start doing Tuesdays from now on instead of Thursdays because of class. So next Tuesday will be a short presentation from myself, Annette, maybe the judge and the mayor, but the majority of the time will be for Dr. Bird, and then Thursday will be the city staff and the elected officials only on Thursday. Okay, so we'll see you next week. Stay safe and remember those COVID protocols. Thank you.